and welcome to Olsem Wanem. In this episode, we take a look at cancer and cancer care in PNG. There are more than 100 different types of cancer. Most cancers are named after the organ or type of cell in which they start. The question is, how much do we know about cancer and how serious they are?
I think since clear of plenty of cancer, think plenty of pavuni all asplo and see cancer. I think me clear some mostly a more cell of boy and mouth cancer and lung cancer all. But on nerve cancer, think of pavuni only clear too much.
Each one of us is made up of roughly 100 million cells, and there are more than 200 different types of cells in the body. Cancer is a term used for diseases in which abnormal cells divide without control and are able to invade other tissues. Cancer cells can spread to other parts of the body through the blood and lymph systems.
Our body is made up of a lot of smaller components we call cells, and each cell has a particular function it has to carry out. Now, when the cell does not carry out that function or grows abnormally, we call it cancer. And these cancer cells tend to disrupt the normal functioning of the body, tend to cause disease, and also tend to spread very rapidly.
A neoplasm or a tumor is a group of cells which have rapidly growing, and there is uncontrolled growth of these tumor cells. If you look at tumor, there are two types of tumor. One is a benign tumor and the other one is a malignant neoplasm or a cancer. When we talk of cancer, these cells form lumps or masses, and they can invade locally and they can spread to the rest of the body through blood or through lymphatics.
Cancer also has its different stages.
There are 5 stages. The pre-cancer stage where chronic infection is stopped, but then come up cancer to us yet. It's just starting. We call that stage 0. And then the stage 1, 2, 3, 4, and close to diabetes.
The cells in our body grow and divide in a controlled way to produce more cells, as they are needed to keep the body healthy. When cells become old or damaged, they die and are replaced with new cells. However, sometimes this orderly process goes wrong. The genetic material, DNA, of a cell can become damaged or changed, producing mutations that affect normal cell growth and division. When this happens, cells do not die when they should, and new cells form when the body does not need them. The extra cells may form a mass of tissue called a tumor. Normal body cells have a number of important characteristics. They can reproduce themselves exactly, stop reproducing at the right time, stick together in the right place, self-destruct if they are damaged, and become specialized or mature.
Papua Guinea the commonest one for the ladies is cervix cancer, and the second commonest in the ladies is mouth cancer, and the commonest in the men is mouth cancer.
The common cancers in Papua New Guinea are cervix cancer, mouth cancer, breast cancer, and other cancers.
If you look at the causes of cancer, there are mainly environmental causes and genetic causes. 90 to 95% of the causes are environmental causes, like, to name a few, like chemicals, like tobacco and alcohol. Hereditary causes, which are inherited in the genes, which form around 3 to 10%, commonly seen in breast cancer, ovarian cancer, prostatic cancer, colonic cancer, to mention a few. There are other reasons for cancers, like obesity, where there is reduction in the immunity and the endocrine system, suppression of them, and environmental causes, pollution can cause, and infections.
Welcome back to Olsem Wanem as we feature cancer care in Papua New Guinea. Papua New Guinea has one of the highest cervical cancer rates in the world, despite the fact that cancer is highly curable if detected early enough. However, this is not the case for many women in the country. We now take a closer look at its causes and prevention methods. So what is cervical cancer? Cervical cancer occurs when abnormal cells on the cervix grow out of control. Most cervical cancer is caused by a virus called human papillomavirus or HPV. HPV is contracted through sexual contact.
Okay. So cervical cancer, cancer long mouse long baby's bag, where pikinisa come up long end, and the cause is a virus that causes a chronic infection in some ladies. Some blood meri oli kisim this virus, immune system belong all is arousing back this virus. No no sa kisim cancer. But some blood meri immune system belong all no sa good arousing back this virus. So virus I stop na come up in more same chronic infections. I stop 10 years or 15 years, and time em stop long time or same cancers that come up. So this is like one Mary where all is come up chronic infection long this like human papilloma virus or HPV, all trangu or kisim cervical cancer.
A woman can have HPV for many years and not know it. It stays in the body and can lead to cervical cancer years after the body was infected. The biggest concern is the late diagnosis of cancer.
Well, that's the big problem with cervical cancer. When in its early stages there are no signs and symptoms. So that's why it's so important to prevent it. Because by the time you develop signs and symptoms, time will something come up like you now where you can look sabe or some abnormal bleeding, or you lose a little spot of blood behind long sex. This is like kind symptom early, also call him early symptom, but early to masia. Because time me plus check him or Mary only come one time first symptom, or some aste night all, only look him first spot of blood behind los sex. Me plus said pine or same only got stage 2 cancer pinisia. So there's usually no symptoms for stage 1. This is the stage where you can walk him operation rouse him. So everyone play hard work something through here. So Yumi sabe got screening strategies now long. Try to look sabe long who said he got pre-cancer or same kind chronic infection is stop long cervix where this like HPV virus is stop or same by you kiss him screening or same doctor by look him cervix playo and walk him test lo cervix playo.
Symptoms of cervical cancer may include bleeding from vagina or a change in the menstrual cycle that one can't explain, bleeding when something is in contact with the cervix, pain during sexual contact, and discharge of blood.
The first thing that should be done, of course, is don't get it. That's the very first thing, because all the other strategies to help us with this cervical cancer problem are really technically quite difficult. Avoiding it is actually quite simple, as I've described. Just don't have sexual activity with boyfriends until you reach full maturity, which is about, as I said, 18 or 19 years of age. And then after that, use condoms until you've really decided on your lifetime partnership. But in our society, the boys are in charge of sex. So often girls just have to give way, as it were. So some poor girls get into the situation where the boy puts pressure, so it's very difficult to wait till 19 or wait until marriage to take off the condom. So if you've had this kind of life as a youngster, and then now you're in your late 20s, where you might have got an infection back in your teens, and now the infection has been present for the sort of period where it might start causing cancer, then yes, you should come for check. And there's in the national capital. This is for the national capital. Also in other provinces there are clinics, but in the national capital, all the private clinics have ladies' specialist doctor, and of course in the Port Moresby General Hospital, the ladies section.
Breast cancer is also common among women in Papua New Guinea. Breast cancer not only occurs in women, but also in men.
Breast cancer are common. The most common cause for breast cancer is genetic predisposition. There is a defect in the gene. The family, women who have cancer, they have very strong family history of cancer, either their mother or their sisters having breast cancers or ovarian cancers.
It typically produces no symptoms when the tumor is small and most easily cured. For it is very important for women to follow recommended screening guidelines for detecting breast cancer at an early stage.
If you look at cancer, there are signs and symptoms which are particular to a particular cancer. Like, if you take the breast, the women can feel a lump, women can have swelling in the breast or discharge from the nipple, blood stain discharge specifically. And if the disease has spread already, they can come with, like if it is spread to the liver, the women can present with jaundice, or if it is spread to the bone or the spine, they can have pain in that area, or if it is spread to the brain, then they have symptoms of tumor in the brain. Okay, and along with this, they can have generalized symptoms like loss of weight, loss of appetite, generalized tiredness. These can be there.
Like other cancers, breast cancer also has its signs and symptoms. Pacific International Hospital is one hospital that provides screening for various cancers.
I think the good news is a lot of Papua New Guinea women breastfeed their children. Okay, and breastfeeding does definitely have a correlation. Okay, there is a correlation that women in general, when they have children and they breastfeed, okay, that is a good prognostic factor. Definitely. This is the new mammogram machine which PIH has procured, and as I told you earlier in my interview, that when women get screened, especially women more than 40, it has been documented in the literature that the mortality rate almost comes down by 30 to 40%. So here we have a screening modality for breast cancer, and I urge all my viewers, especially the women, please make use of this facility which is available here. And as I told you earlier, PIH does offer discount on all these screening modalities.
The chewing of betel nut has been around in Papua New Guinea for many years. It is strongly within our traditional cultures. Today it provides an income for many people in the informal sector. The chewing of betel nut also raises serious health concern. More than 2,000 people die each year from mouth and throat cancer caused by betel nut chewing. We now take a look at oral health and mouth cancer.
Well, the mouth, which consists of basically our teeth, our tongue, our gums, our cheeks, is the window to our system, in the sense that whatever we eat, whatever we consume, finds a path directly to the rest of our body. In our medical textbooks, it says that the mouth is basically the window to your entire well-being. So if we look after our oral health, in a way, it also affects our general system well-being.
Oral health and hygiene plays an important role in our well-being. According to Dr. Hamadani, gum diseases and tooth decay are two of the commonest dental problems in Papua New Guinea.
The gums are unhealthy, or the bone is unhealthy, or the teeth are decaying. It presents or it creates what we call an unhealthy oral environment. So the most common or the most prevalent dental diseases or pathologies that we see around is gum disease, which many a times appear as bleeding gums, many a times appear as smell. A lot of people say they have bad breath. A lot of people say they have their teeth unmoving. All of this happens when the gum and the bone become diseased, and that's why the teeth lose their support. So that's one of the most common dental diseases that we see. Another very common dental disease that we see nowadays, especially with the younger generation, is dental decay. Dental decay, our teeth are basically made up of calcium. It's a hard tissue. Now, a lot of our younger generation, we are into this fast food culture. Our older generations, like our boo-boos and our grandparents and our parents, they were used to eating food from the garden, healthy food.
Apart from tooth decay and gum diseases, we are now faced with an even more serious health issue in the country, and that is mouth and throat cancer. In Papua New Guinea, these are strongly related to betel nut chewing.
From my observation, I've seen that many Papuans not taking mouth cancer very seriously. We came across to Koki Market one day, and I was with a doctor at from the Pomjen Hospital, and there was this guy who had a sore on his ear, and that sore was almost there about some months or a year, and he didn't even thought of having a medical checkup. And I was with this medical doctor, and we asked the doctor what he thought of this sore, and he said that he has to go and take a checkup while he's at this premature stage. And he was actually carrying a mouth cancer around without realizing that sore was eating the gum away. Yeah. So the doctor advised him to go and take a medical checkup. So your question now relates to that people are careless. Any small sore that comes out, they think it's just only a Kanban cooking or this line about, and they just disregard a sore, and not realizing that the sore is now from that premature stages become, and by the time they go to the hospital, it's already a full-blown case already.
For example, in Papua New Guinea or in around the world, tobacco, smoking of tobacco, for example. You see the tobacco fumes, the heat caused by the smoking of tobacco, traumatizes the gums, traumatizes the oral cavity, and we see oral cancer. A very common cause of oral cancer is tobacco. Another very common cause of oral cancer in Papua New Guinea is the chewing of the betel nut along with the caustic lime. Because not only does the betel nut is an active carcinogen, but also the caustic lime, the lime of the what do you call it in
Kambang.
the kambang. The kambang, it's lime, it's caustic. It causes chemical burns in the mouth, and repeated insults to the oral cavity results in the cells
Weakening?
you could use the word weakening, but it's not so much weakening, rather than malformation and disease forming cells.
Lo mia te misa feel good lo kai kai buai. Because me lining long kai kai buai since me lily girl. So me growth up one time buai. So me painim hard lo lusim buai. So me lusim buai. Te me feel lo sa me by die or me by sick. So time me come lo sabe lo smoke na buai na smoke te mo sa come good. So
That betel nut is contributing to the mouth cancer. It is because what I personally see that some of us, we chew recklessly, carelessly. If all people didn't have this mouth cancer, and why is the current generation having mouth cancer? It's just because that people are careless.
When you look at cancer as such, every year, if you look at the statistics, around 14 million people are affected by cancer. This is according to the 2012 statistics. Around 8 million people are dead by the end of the year, and the rest are living with cancers. And if you look at PNG as such, there is a very high incidence of cancer, both in men and women, okay, which forms around 150 to 200 people develop cancer for every 100,000 population.
Cancer remains a challenge in Papua New Guinea's health sector. There is a lack of awareness, often leading to the late diagnosis of cancer. But that is not all. It is a combination of money, resources, and the availability of doctors.
Needs to produce good awareness materials for all the health problems of this country. We don't have good health awareness materials for family planning, for cancer prevention, or so many things. I think our unit, what is it called, the audio-visual or the health promotion unit in the health department has been sleeping, or perhaps not funded. I don't know, it's not my section of the health department. But it needs to be much more active and helping all the health workers with health promotional materials. About 30 years ago, I remember when I was a young doctor, there was a very dramatic poster of a buka lady chewing betel nut and beside a picture of a man with a mouth cancer. It was very dramatic indeed. And anyone who looked at that poster would get the message immediately. The link between Hamamaslong come up in red mouse blayu and this la trangu igat this la mouth cancer sikya. We need some of those health promotional materials for today.
Yeah, looking at the patients who present to our clinic, most of our patients present in a very late stage. And it is almost sad to see a lot of people don't even realize that they have cancers, especially cancer of the mouth, cancer of the tongue. They think it's just a sore.
Many a times, because a lot of people, for one, do not have access to oral health facilities, and many a times they also tend to neglect their oral health. It's a combination of a lot of factors. But like I was saying, if detected early, oral cancers can be prevented, can be treated, and even cured most of the times. Visiting your nearest health clinic or visiting your nearest dentist the moment you see something wrong or you see something unusual is recommended. It's better safe than sorry. Well, at Mills Dental Care, we provide a variety of dental services. We are quite comprehensive, right from preventive to restorative to surgical.
Similarly, cancer of the breast. Not many women examine their breast or come to medical help when they have a mass in there or a lump in their breast. So definitely people are coming late here for care, medical help. So if they could come early, and if and we do have all the facility here, and as a token of appreciation to the community, to the nation as such, PIH, we offer 40% discount for patients for their CT scans, for endoscopies like gastroscopy, colonoscopy, flexible sigmoidoscopy, and we do have mammogram. We do give concession for mammogram also, and this is a way in which we reciprocate, and we want more and more patients to be screened, and if they have a problem, we could diagnose and treat them in the early stage.
Unfortunately, many people in the country die because many of them have cancer in the later stage of 3 and 4. Very few of them are lucky to able to seek medical attention and have surgery done in stage 1 and the early part of stage 2, who are able to survive. But unfortunately, we lose a lot of people from cancer.
Not all, no, it's true that not all. Some of the smaller provinces like Kerama, Daru, some of these smaller hospitals, they don't have special women's clinics where women can go and get screened. But most of the bigger hospitals do, like Mount Hagen, Leh, they have the special clinic.
Suggestion to the viewers will be to, one is to our lifestyle. It is, you can reduce the chance of cancer like lung cancer by reduce smoking or even stop smoking, reduce the consumption of alcohol, better lifestyle, dietary habits. eat more of vegetables, fruits, less of red meat and spicy food, burnt food, because the incidence of these, there is a correlation. These can be carcinogenic. And
to live a healthy lifestyle, eat good, eat well and eat healthy, and at the same time try and maintain a good level of oral hygiene. Every time you crave for something sweet, pick up a fruit, chew on it. Don't open a packet or don't drink it out of a bottle. That's the more healthier choice when you try and be as natural as possible and try and consume as natural foods as possible. Visit your nearest health facility or visit your nearest dentist at least once every 6 months for a good checkup and maybe, if required, a dental scale and clean. And brushing at home, flossing at home is irreplaceable. Each one of us needs to pay meticulous attention to maintaining a good level of oral hygiene.
I think there's not enough awareness because all awareness come up loan sa come up tasolo or some all merigat or some breast cancer and all this like or mouth cancer all this like you got plenty or some all cancers where you mean sawe longan. Na I think there has to be a lot of awareness because one plus symptom blow cancer where mino sawe longan time you got source lo tang blue it's just a sign blow some cancer walk lo form longan. Mino sawe this lata sol time all 1 year 3 mile all doctors all been go working awareness lo Crown Plaza Hotel and me been looking this land and me realizing mo some emon plaka no some symptom lo so mo some this cancer. Na a lot of people are living with cancer me believe was because all these little symptoms all no sawe longan na all no na lo go lo ausik unless you me oklo kim awareness plan din na make him all look sawe or all these all symptoms they will lead to cancer na it's better to prevent than to cure him.
And that's all we have time for on Olsem Wanem. I hope you have learned a lot about cancer and cancer care in Papua New Guinea. Be mindful that prevention is better than cure, and it is wise to get a regular check from your health center, as well as be informed about your health issues. If you have any comments or stories you would like to share, please contact us via the address on your screen or visit us on our Facebook page. For now, enjoy the rest of your viewing on your #1 station and TV.